Christy, I'm going to go ahead and turn it over to you.
Hi, good morning. I'm Christy Wills, the Communications Officer with the Roanoke City and Allegheny Health Departments. Welcome to the special news briefing that we have today. Per our usual routine, we will kick off the conversation and open the floor up for general questions from the media for Dr. Morrow. And we'll do that for about 10 or 15 minutes, get some of those immediate questions out of the way. And then at around 11:15, I will step in and change the topic over to the special health equity briefing with the guests that have joined us today. And so at that point, if there are additional questions that reporters have that are beyond the health equity topic, if you'd like to remain on the line, I will confirm that Dr. Morrow will be able to stay on the call if there are any additional questions, but we want to respect the time of our special guest today. So for now, I will turn it over to Dr. Morrow, who will kick off her routine news briefing, and then I will step back in about 10 or 15 minutes. Dr. Morrow?
Thank you so much. So I'm just going to start with a daily update in terms of our COVID activity, and then I'll move to our vaccination strategies. Our cumulative case count, and I should mention that I will, of course, be providing the data for you later after this phone call. Our cumulative case count for the Roanoke City and Allegheny Health Districts is 2,681, which represents a 400 case increase since last week. This shows that we're continuing to have a downward trend. However, it is still substantial activity. So I know I said this over and over, this is not the time to let our guard down. We still have 400 cases, new cases in our community over the last week. And if we think back to the fall, if I had announced that we had 400 cases, that would have been a big moment for us to say there's a lot of activity. So I just really cannot stress enough that this trend is really good news, but there is still substantial activity in our community, and we must continue to follow our community mitigation strategies. I'm going to not go through the breakdown just so that we can get to our equity talk. But if we look at where we are with hospitalizations, there's also some really good news with respect to our hospitalizations. We had a total of 32 hospitalizations reported to us over the last, yesterday. 17 of those hospitalizations are new from this past week. With respect to COVID-19 related deaths, unfortunately, we continue to have people in our community who pass away from COVID-19. We do know that our mortality data are delayed, but this represents just the tremendous loss that our community has experienced because of COVID-19. So our current COVID-19 related death numbers, we've lost 338 members of our community. 259 confirmed cases related to COVID-19, 79 probable. 205 have been residents in our Allegheny Health District, 133 in our Roanoke City Health District. With respect to our outbreaks continue to decrease. We have a lot of outbreaks that should be ending. We follow for a 2-week incubation period after the last case reported. And we expect that a lot of our outbreaks will be resolved in the next week. But as of now, we have 12 outbreaks that continue to be predominantly in the our long-term care facilities and our congregate living facilities. With respect to our situation update, we, like the rest of the state, continue to be in high burden, substantial activity, but decreasing trend. And with respect to our school metrics, there is some good news there. Most of our school districts are still in the red if we look at our 14-day incidence, which continues to be the primary indicator. But we do have Allegheny County as being in lowest risk and Roanoke City as being in higher risk. So those are at lower risk than our highest risk schools. With respect to our vaccine efforts, so that concludes our COVID-19 activity situation update. With respect to our vaccination efforts, we are on target really getting vaccine off shelves into people's arms. last week we did, like most areas, we did have a delay. We did not receive our first dose Moderna. So when you see the numbers, you'll see that our doses for last week were down by 900, and that's because of not receiving our Moderna vaccine. We did receive it yesterday, and we are on target to get all Moderna this week's first dose allocation and last week's first dose allocation into arms. The other thing that I think is important for our community to realize is that the federal retail pharmacy program has really kicked in. And this means that at the federal level, there's federal allocation of vaccine directly to pharmacies. We're going to be working with our pharmacies to ensure that the right people get to the pharmacies. And we'll be sharing our lists of people over the age of 65 with the pharmacies. So we'll be having an additional 3,700 doses of vaccine this week that is coming through the federal retail pharmacy program, in addition to our 3,000 plus allocation. And with that, I'll take questions for a few minutes before we move on to our equity discussion.
Hi, Dr. Morrow. This is Jessica from WSLS. Can you hear me?
I can, thank you.
Yeah, so I just had a question for you. Dr. Fauci has said the general population should expect to see vaccines in May. Do you think that's a realistic projection in our area?
You know, it's really hard to predict. I will tell you that when I got the call on Saturday evening that we would be getting 3,700 doses in our community through our retail pharmacies, I was very surprised by that in a good way. That's wonderful news. That means more vaccine is going to be getting to people in this upcoming week. But it does also illustrate that the predictability of the supply is still it's still unpredictable. If we continue to have this level of vaccine, and if Johnson & Johnson comes on board, as we expect it will relatively soon, then I think that projection is realistic at the local level. But I'm cautious because, of course, if we take last week as an example, just because we didn't get vaccine, and it shows the vulnerability of doing what we call just-in-time vaccine delivery. I am hopeful. I would love to be in the position where we can say in May that everybody who wants to have vaccine has access or has an appointment for access. But I think we need to be a little bit cautious, knowing that we've had some stumbles in the past.
Great. And then just one more question for you. We're still hearing from frontline workers who haven't heard when they're getting the vaccine. So can you tell me where we are in vaccine distribution and how far through which priority group we are?
That's a great question. We still have been focusing on our top 3 tiers of essential workers. And a primary reason behind that is that we knew once the recommendations were made to vaccinate people above the age of 65, that was a huge population that was far greater risk of becoming hospitalized or dying with COVID-19. And so we really pivoted to try to ensure that we're reaching that population. Now and we were doing about a 50-50 distribution at the time. With the federal retail pharmacy programs coming on board, that allows for more vaccine to get to that higher risk population with respect to hospitalization and death associated with COVID-19. What that means is it frees us up a little bit to start expanding access to vaccine for some of our other essential workers. So we are actively planning for that. The other thing that gets a little bit complicated is that the PrEP mod program and VAMS, those are our 2 major vaccine administration programs. PrEP mod is still having some struggles, especially with people inappropriately and unethically sharing the link. The initial idea was for us to transition from VAMS to PrEP mod by the end of February, which of course is right on us. Because of the problems with PrEP mod, we are delaying the transition, which means that we will be getting essential workers in through VAMS. And we have the database to be able to do that efficiently and effectively.
Dr. Morrow, this is Tom Bird, WFXR. We're hearing from some viewers that are concerned about the reactions to the second dose of the vaccine, they're seeing family members get it. And what can you tell them to downplay their fears that these reactions are abnormal?
Well, so I think it's really important to hear people's concerns and then to provide them with what we know that the evidence is. And certainly there are people who get minor side effects from both the first and the second dose. And we're seeing higher rates of low-grade fevers, body aches, headaches with our second doses. And that's happening across the globe. And one of the things that I like to say, my husband is a physician, and he had a pretty decent fever associated with his second dose. And I like to say that's proves that the vaccine is working, right? Your body is reacting, and it's recognizing this foreign foreign subject that's saying, okay, I don't want this to be in my body. That's really, it's really simplified, but it shows that the vaccine is working. These are very short-term side effects. And in the big picture, it's certainly the message is these are safe, effective vaccines. You may get a low-grade fever, you may get body aches, but at the end of the day, that's so much better than getting a risk of taking the risk of getting COVID. So the bottom line is these are safe, effective vaccines. We do need to be transparent that there are some people who will have side effects, and we just need to be supportive of them, when they have those side effects. The other thing that we're seeing more with Moderna than we're seeing, it's not being seen with Pfizer, is local reactions on the arm. And that too is a temporary, non-dangerous side effect. And we just encourage people to get vaccinated because we know it's a safe, effective vaccine.
My daughter don't, RJ Hinkle?
Thank you, Dr. Morrow. I will step in at this point so that we can pivot to our health equity conversation. Reporters, if you are able, Dr. Morrow, would you be able to stay on the line after the conversation for a few additional
Sure.
questions, should there be any? Okay,
Absolutely.
great.
I'd be happy.
Well, thank you very much. Great. Well, thank you very much to all of our guests today. In addition to Dr. Morrow, who is the health director of the Roanoke City and Allegheny Health Departments, we are joined today by Mayor Sherman Lea, Mayor of the City of Roanoke, as well as City Manager Bob Cowell. We also have N.L. Bishop, who is the Chief Diversity, Equity, Inclusion Officer with Carilion Clinic. And we're also joined today by Shirley Holland, who is the Vice President of Planning and Community Development at Carilion Clinic. And the purpose of the press conference today to particularly talk about health equity is a chance to really focus on how partnerships have been key to address some of the historic challenges that have been presented by the way that we have had science meeting the challenges that have been going into making sure that all communities have access to the vaccine that has been developed just as recently as last fall. So with that, I'll turn it over to Dr. Morrow to begin the discussion. And Dr. Morrow, as you would like, please welcome in our guests to describe how they have joined you in the effort.
Thank you so much. And I know that on our media calls, we've been talking a lot about health equity, and I've been a bit of a broken record about the importance of partnership. So it's just such an honor and a privilege for me to be here with the health department's key partners in trying to achieve health equity. I think it's really important for us to just start with the recognition that we have populations within our community that have historically been underserved and at times mistreated by the healthcare system, by the public health system. There are lots and lots of reasons why we, as a community, as a state, as a country, and as a world, are facing inequities, many different ways. And it is the responsibility of all of us to ensure that everybody is assured the conditions in which they can reach their optimal health. And this group is an amazing group of folks who are really dedicated to ensuring that everybody in our community has equal access to achieve their optimal health. So I'm just so thrilled to be here in the company of these wonderful people. I've talked a lot about health equity and what we've been doing, and I really want to take this time to let our partners talk about what they've been doing. And so I think let's just open it up to our partners. Christy, if you want to navigate that for us.
Mayor Lee, could you please join in?
Thank you. And let me thank all of you all of our partners for coming together today, and Dr. Morrow for your leadership as we go forward. Roanoke City Council remains committed to partnering with our local healthcare providers and the Virginia Department of Health to keep community members safe and to provide the opportunity to receive the vaccine to as many residents as possible. One example of our recent efforts is the 2 vaccination clinics hosted in the community to reach our African American and Hispanic residents ages 65 and up, who may not have had access to online registration. Hosted by the City of Roanoke and the Virginia Department of Health, these clinics were held to reduce barriers for some of our most vulnerable residents. At these clinics, 200 people were vaccinated, with one of the recipients being 102 years old. I think that's awesome. The city and will continue to reach out to minority groups in our community to ensure equity for those who want the vaccine. And Roanoke received a grant from the Virginia Department of Emergency Management to help in these efforts, resulting in the hiring of a bilingual COVID support specialist position. In this role, Katie Hendrick is currently assisting the city and the VDH with engaging the Spanish-speaking members of our community. She's working with Casa Latina as well as neighborhood groups to ensure the Hispanic community understands the risk of the COVID-19 virus and the importance of following COVID protocols. She's also helping to educate them about the safety of the vaccine, how to gain access to it. And we're hopeful that these and other efforts will move us more quickly toward the path to reducing and eliminating the spread of COVID-19. And I call it equity in action. Thank you.
Thank you, Mayor Lee. Now, we would like to invite NL Bishop to describe some of the efforts and the partnership that Carilion has brought.
Thank you very much. First, I want to say how much we appreciate the opportunity to be in partnership with the city. We really have a good relationship with the mayor, the city manager's office, and with Dr. Morrow, and we really appreciate the opportunity to work together in this great cause. So I think that Dr. Morrow and Dr. Lee both did a great job illustrating the issues and the challenges, and then the work that's being done to address health equity matters in our communities. I'll keep this brief so that we can open the floor to questions, but I would like to underscore the fact that our work to address inequity extends to our entire region. In fact, throughout our organization's footprint, Carilion Clinic works with 6 districts across Western Virginia to help bridge the gap. We recognize that there are many who struggle with access to technology and transportation. There are issues such as having access to computers and telephones for some of our friends and neighbors, and where people live, sometimes in rural areas, not having broadband, not having a car or an easy method of transportation. All of these present their own work to make sure that everyone has equitable access to vaccine resources. That's what makes partnerships between us and working with VDH, the city of Roanoke, and other municipalities and community partners such a crucial matter. This is a very complex issue, and a complex issue like health equity requires a robust solution. We recognize that there are inequities and disparities. Dr. Morrow just a moment ago talked about some of the distrust that exists and some of its historic nature. And we recognize it's not something that we will be able to fix overnight. But we've already started to see the difference that focused, boots on the ground efforts will make. In Franklin County, for instance, teams at Carilion Franklin Memorial Hospital have partnered with the West Piedmont Health District and then leaders of the Pig River Baptist Association. This is an organization made up of several local churches. Thanks to the good work of that community network, coordinated transportation, and sign-up assistance by way of telephone trees, more than 350 community members with limited internet and transportation were able to receive their first vaccine dose in one day. Dr. Morrow and Mayor Lee also highlighted the great efforts happening right here in Roanoke, and we're pleased to work in helping in those situations where we can as well. We're just really pleased to join the city and the health districts and to be included in this work. And I appreciate being a part of this discussion today. The main point is that we are all committed to doing all that we can to overcome these areas of inequities and disparities as we work to get vaccinations into the arms of our neighbors and friends and families. And so with that, I'll turn things back to Christy.
Thank you, Dr. Bishop. And with that, we will open the floor up. If reporters have any questions, please know that Bob Cowell and Shirley Holland are standing by and can talk about some of the details of the recent rollout. The floor is open.
Question for the city of Roanoke. I understand you guys are part of this partnership and making these efforts to reach this population of people or these different populations. What resources has the city committed to this initiative to get all these communities access to the vaccine?
So I'll start, and then if anybody else wants to jump in with it as well. So I'll use the two clinics that we had recently. So the first resource that was made available is actually our personnel. So we referenced using kind of phone banks as a way in which we could register residents in the area or pre-register them for the clinics. And those phone banks were actually staffed by our library personnel. So in two different libraries, we had library staff there to answer calls. We also have used the community engagement office has been kind of leading in part with that outreach coordinator that the mayor referred to out into the community, but we've been doing that through two different working groups of our citizens. And so for the past several months, we've built this relationship with various kind of influencers within the community who can then go out into the community and make those connections. And then our emergency management personnel have been involved in the logistics, not only of these events, but also of the mass vaccination clinics that have been going on at Berglund and at Salem. So that's one, that's the people resource. The other resource that we put into it are actual dollars. And so those are the funds that were referenced out of the VDEM grant that the mayor referred to from the Department of Emergency Management. So that's allowing us to get information published, for example, in English as well as Spanish and other languages. That's actually allowing us to do something as simple as buying wheelchairs so that at these clinics, if someone actually needs to be brought from a car to the actual site of vaccination, that we have a wheelchair to actually move them. And then the last thing I'll say is the real resources we relied upon are our community. So the clinics were held at the school at Breckenridge. And so our partnership with Roanoke City Schools allowed that. and at one of our area churches. And so that partnership, so those community resources have been essential in it as well. So those are examples of the resources that we brought not only to these 2 pilot clinics, but hopefully to ongoing efforts like this as we continue to reach out into these parts of our community.
As Mr. Nolan mentioned, this isn't an issue that gets solved overnight. For you guys, are you pleased with the numbers and how things are improving? And this is open for anyone, whether it's the city or Dr. Morrow, but are we pleased with making these partnerships and the numbers that have been the outcome, or is there still a gap there that you guys are hoping to address?
I think I'll address that just because it's such a big issue that goes beyond the clinics. It is clear that to try to overcome inequity, it's going to take us a very long time, and it's going to have to be intentional, and it's going to have to involve not only all of our partners who are here on the call with us, but it's going to have to involve partners beyond partners of all of our partners. It's going to require an intentional long-term effort. And I know all of us on this call are committed to using this new dedication to partnership way beyond the to improve, to address health disparities and improve equity beyond COVID. There are so many structural and social determinants that are at play here that we want to use, and I hope that I'm speaking for all of us. I think I am after all the discussions we've had. We want to use this as a platform to build on, not to rest on. And that's what is just so important. Are the numbers where we need them to be? No, we need them to be much, much better. And what I know is that with all of the energy of the partners in this room, we're going to be able to do a lot, and we're going to continue to have to do a lot moving forward.
Hi, where do you guys see is the biggest area of focus that is still needed in kind of closing this gap of equity?
I guess I'll take that one as well. Please, anyone to jump in. We're just at the beginning of closing the gap. So I would say we still have an incredible amount of work to do. We were on some email exchanges earlier today about the importance of developing a sustainable plan. This is not just 2 clinics and we're done with it. This is the beginning of our plan. So I'm a little bit hesitant to say where do we need to still address the gaps, because we still have a gaping gap in front of us. We're just at the very beginning. So we have a lot of work to do in terms of engaging our Black and African American population. We have a lot of work to do with engaging our Hispanic population. We have a lot of work to do to still engage people who may not have access to technology. We're actively working at every one of our clinics. How are we ensuring accessibility for people who have disabilities? So there's still a lot of work to do. And I guess I would just say, we're still at the beginning, and what I can say, this group is completely dedicated to ensuring that we close all of the gaps.
And then for folks who hear this and really want to help with this effort, know that they may know some people that could hear this message or could help move resources to, how can they get involved with you all to help kind of close this gap?
I'll take a first shot at that. And, probably I think the best way that they can help is if they know folks who are currently eligible, but for whatever reason have not been able to or been reluctant to do so, to get pre-registered, to get them connected into that structure. So going on to the VDH hotline and actually getting folks pre-registered. If that means helping someone actually through that process, all the better. I think that's still the key piece right now, is getting as many people into that structure and into that system that are eligible as is possible, because that's kind of the foundation of all the work the rest of us are doing, is kind of knowing who we're missing and reaching, and then also helping us tailor kind of these outreach clinic efforts as we go forward. So that would be number one. The other resource, I think, as we continue to advance on this, the other thing folks can help us with is helping spread factual information so that folks really understand the need to get vaccinated and the safety associated and the efficacy associated with the vaccine. Those are really critical as well. Fortunately in Roanoke, we don't have a problem with folks wanting to volunteer. We don't have a problem with folks offering up their facilities for clinics. So that's actually not where the gap is. The gap is really getting people connected into the structure so that we can get more folks actually vaccinated.
In our region, people that live in rural areas and people that don't have access to broadband is really a reality. A few of you have mentioned that. Can you go into more detail about how you're trying to reach people in those rural areas?
Well, I was going to say, I can speak for our rural areas. If Mayor Lee, did you want to add something?
I was going to talk about pretty much how we're reaching people, but I think one thing is that we've got this, what we call the strike team, and it's a list of citizens who we've asked to go out and to do the things that Bob just mentioned with regards to contacting people, educating people, and letting them know that that we have the programs and the facilities available to help them. And so, and we're doing a lot of that, and I know in our urban areas. And I'm hoping that something similar to that is taking place in our rural areas around this Allegheny district.
Yeah, that's exactly right. And so I'll talk a little bit about what we're doing with our health districts, and then if Dr. Bishop or Shirley Holland would like to talk about the rural efforts in some other districts, I think that would be great. So within the Allegheny Health District, we've been from the first week that we received vaccine, we've had clinics in Craig and Covington County, in Craig County and the city of Covington. In addition, we've had a strike team in one of the more rural areas in Botetourt County, and we'll have another, we'll have more efforts with that later this week. So we're trying to make sure as a health department that we're doing both standing clinics in our rural communities, as well as some of these, what we're calling our community outreach vaccination teams, or our strike teams. So that's what we're doing, but I'd love to also hear what Carilion is doing.
Well, one example, as I pointed out earlier, was over at the Pig River Community Center. We took advantage of the connections and relationships that they have within that community. We didn't know how necessarily to be able to get to people, but they did, and were able to contact persons who lived in some of the most rural areas inside the community. They knew the names, they knew who lived in some of those places, and were able to get those names and put them on lists so that they could be contacted and be pre-registered so that they could come and get the vaccine. That's one example, is being able to listen to people in the community who do know the people and how to get into contact with them.
And that's, thank you so much for bringing that up, because I think I sort of glossed over what we were doing. City Manager Cowell mentioned this earlier, that our emergency managers have just been such an amazing partner in all of this. And so our emergency managers know their communities. When we have a clinic in some of our rural communities, our emergency managers are out there making those connections that Dr. Bishop just talked about as well. And so this really, I know we started with this, and I know we've talked about it a lot, but it really is all about partnerships and having people in the community who are trusted community members to help us identify the right people and build trust.
Hi, everybody. This is Leanna Scicchetti with WDBJ7, and I have a couple technical questions for you, if I may, acting as a vessel for the community for their questions. We're sharing this conversation live on Facebook, and I've taken a couple questions from people about that new vaccinate.virginia.gov website, which allows people to see that, confirm that they have been registered. But I've taken a couple questions from people who want to know if there's a resource available or if there will be a resource available that's going to show them where they are in line.
Sure, I'm guessing that question is for me. It's a bit of a challenge because there isn't a line per se. I know Christy likes to talk about this as well, that we really talk about groups of people. So you can imagine that it's not apples to oranges. We've been talking about the importance of equity rather than equality, and certainly we have differential approaches to try to ensure that we're achieving equity, not equality. And I know that can be really challenging, but for those reasons, it's important for us not necessarily to think of where someone is in line, but what group they're in, where the prioritization is, and what that looks like. Now, I will tell you that that website is a work in progress. It was populated with all of our pre-existing data as well as oncoming data. And so they're continuing to make strides to help people understand how they can go online and change information if information has changed. There's a lot of work that's still going on, but I'm really excited about having this tool available for us. And I really think that in the long run, it's going to serve our community well.
And then a follow-up question, if I may, as well, when it comes to health equity. Obviously, you guys are doing this sort of grassroots partnerships here locally, but are there other resources that you'd like to see come from the state or even from the federal government to help address the issues right here locally? Anything that, if you could wave a magic wand and receive from the federal government or from the state in order to meet your goals, what would they be?
I think we're all looking at each other to see. I don't know if my partners have ideas. I think one of the things that I would love to see moving forward is better health information technology from a population perspective. So if we talk about equity, if we don't have good ways of gathering data and really being able to effectively hotspot, meaning identify those areas, those neighborhoods in our communities that are disproportionately hurt by drug overdoses or COVID-19 or colorectal cancer, if we have better health information technology, and what I'm going to get on my soapbox, we know that public health has been chronically underfunded. It makes it very difficult to turn around and provide the community with the services that they deserve. So my big ask for the federal government is sustained levels of public health funding, particularly with an investment in population-based health information technology, so that we can be much more proactive rather than reactive in trying to address health equity.
Yeah, I would add, not to be really too succinct, but one would be more vaccines, more doses. Obviously, that would help across the board. And I know that the federal government is doing a lot in that area. And then to pick up what Dr. Morrow said too is, obviously for the last year, our public health conversation in this community has revolved understandably around the pandemic, but she has a whole host of other responsibilities, as does the rest of the community, in trying to address those public health needs in our community and really ensuring that our partners, which are great partners right now in the form of the state government and the federal government, don't walk away at that point once the vaccine or once the pandemic is over or managed. Many of the things that we're talking about, the disparities, the inequities that we have, as Dr. Morrow said, pre-existed the pandemic. The pandemic has just sort of highlighted in a very clear way where those inequities existed. And so really, I think that would be the long game, is that sustained partnership, much like we're seeing right now at the federal and state level, to address these real issues that exist within our communities prior to the pandemic, and they'll exist again after the pandemic. So for me, that would be areas I think we could certainly continue to look for their help.
Dr. Morrow, you had just used two terms, and I'm hoping maybe some of you and some others could maybe address this: equity and equality. I read that story over the weekend, and I try and avoid reading the comments, but when I did, my jaw just drops as usual. And people in our community who don't understand what equity and health access means. So could you help us better inform people?
Is audio back? Sorry.
Yes.
Okay, sorry. I was just, so this is such a great picture, and there are other illustrations of health equity versus equality. From a public health perspective, it's really important for us to recognize that one size doesn't fit all. So we need to, as these boxes demonstrate, we need to level the playing field by bringing people the resources that they need to achieve optimal health. And so for one family, that might mean that we bring a clinic, we bring vaccine to them rather than bringing them to a vaccine, because transportation is an issue. For another, it might be a language barrier. For another, it might be making sure that we have ramps at our sites, because there's a mobility impairment. But one of the things, and I think all of us on this group feel so strongly about, is that we do need to look at the historical reasons why we're not all on the same box. And it's really important for us to tailor our approach to meet the needs of individuals where they are. And I'd love to turn this over to Dr. Bishop if you want to join in. I think it's such an important concept.
I think that you said it well, and I think that illustration shows it well. Everybody had the same size box to stand on, but that did not mean that everybody had the same opportunity to see across the fence. And I think that a perfect example of that as it relates to the vaccine is this one. When with our first vaccination clinic, we recognized, looking at the demographics, that it was very limited. It was not representing the broader community. And we saw that, and we decided that we would do something about it. We didn't just accept that. We recognized that something needed to be done to make it possible for others to have a better opportunity to participate. And it meant that we had to do something different than what we had done, and that is simply giving the address. So we did some things, and we were very happy to partner with the health department and with the city in looking at ways in which we could get some names to add to this, so that people who were not able to have access to computers, as we talked about, persons who for whom computer technology is something that's just really something they are not familiar with, and sometimes even telephones, and even getting the information in the first place. When we recognize that, we recognize the need to have persons to contact them, some of those persons who are in that 65 and older group, some who are very elderly, and then be able to get their names, so that we were able to then help them to become registered and then be able to get the vaccine. So that's one way to describe it. And one thing that we've actually done, and one thing that we've actually seen improvements as we're moving in a better direction. Dr. Morrow, you have said, well, we're nowhere near where we want to be, but we recognize it and we're committed to make a difference, and we are making progress.
If I could add something to that, what Dr. Bishop and Dr. Morrow has stated, I'm extremely pleased as the mayor of this city and being part of the Allegheny District with how we've come together to work together, to cooperate and to collaborate. No, we're not near the finish line, and there's some things that we need to do, but coming together as we have, I think, is making a tremendous difference. And not only what you've seen and heard, we have a member of council, our vice mayor, that has a call-in program that comes on, I think it's bi-weekly, which gives all the citizens a chance to call in and ask those questions. Dr. Morrow and Dr. Bishop have been a part of that. That's letting the community know that we're doing something, we're working, we're progressing. And that's so important. And as I heard from citizens, that as soon as they know what we're trying to do, they want to come forward. Ministers that want to make their churches available. That attitude is what's going to make this happen. It's coming together. And I tell you, to be quite honest with you, I've talked to Dr. Bishop, Dr. Morrow, and Nancy Agee with Carilion and others. Nobody said no, or we can't do it. Let's see how we can come together. Let's make this happen. And so I'm pleased with the progress we're making. And if we keep that going, like it's always said, if we come together and work together, we can make an impact. And I can see that. And anyone looking across the nation and what we're trying to do, we can see that impact. But citizens want to know, do you care? How you're making it happen. And I think we're doing that tremendously. We got a lot of work to do, but I'm appreciative of the efforts that have come forth with everybody in our district.
Thank you, Mayor Lee and Dr. Bishop. Mr. Cowell, Ms. Holland, do you have any last words before we wrap up this portion of the briefing?
I think the only thing I would add is, to echo what the mayor said, and I know Dr. Morrow says this at each of her briefings, which is, greatly appreciate the partnership that we have. And the beauty of this is a partnership that preceded and will follow the pandemic as well. And so, it isn't just this partnership addressing this issue, it's many other issues in the community. So I certainly am appreciative of that. And to echo the mayor's comments, we remain committed to this effort, and we'll continue to try to do what we can to partner and address the both just the vaccine in general, but in particular the equity in terms of getting pre-registered and access to the vaccine. So thank you for this opportunity.
Ms. Holland?
Can you hear me?
Yes.
I would just echo those thoughts. It's been such an encouraging experience to work with community partners in this work. It seems so daunting, but it's amazing what we're able to do when we approach this together. And when you look at the participation in the clinics, in the COVID vaccination clinics, we are seeing a difference in the makeup of the people that are coming, and we can tell that these outreach efforts are helping. Yes, it's just the beginning, but it is a beginning. And I think we're learning so much from this, how we can do things differently in the future and how we can do things better. And I just want to thank our great community partners in this work.
Thank you. Well, with that, I will thank our guests, Dr. Bishop, Mayor Lee, Mr. Cowell, Ms. Holland. Thank you so much for joining us for this special health equity briefing. Dr. Morrow is going to remain on the line. It looks like she had an additional thought, and so I'll thank our guests. I know that you all may need to go to other obligations for today. And if reporters have a few additional questions, I believe Dr. Morrow has a few extra minutes to stay online.
Yes,
Dr. Morrow.
I just wanted to address Jean's question in the chat box, which really, I think, brings together what Mayor Lee said, what Dr. Bishop said, what Mr. Cowell and Ms. Holland all talked about. This is just, it's the beginning of trying to address inequity with respect to COVID-19, but we plan to use this energy well beyond COVID-19. Our intention is to use our community health needs assessment, our community outreach plans, involve all of our community partners. We have so many amazing community-based organizations that are part of the fabric of our community. And I'm confident that I speak for all of us that yes, to all of the issues that you brought up, Jean, we're going to be addressing this long after the pandemic.
All right, thank you again, and the floor is open. Are there any other topics that reporters wanted to cover? We'll stay on the line for Dr. Morrow, maybe 5 or 8 more minutes, if that's okay. Any additional questions, and then the rest you can either email to me or hold for the Friday mini briefing. Any other questions?
Yes, I had 2 things. One, Dr. Morrow, you said the pharmacy partners will be getting, I think, 3,700 doses. I guess that's starting this week. And how will they be, I mean, are you turning over your list to them? Are they calling people, or how will people get access to the vaccine? Because I know they're all going to want to know.
Yes, so thank you, Luann, for asking that question. It's a combination of efforts right now. You can imagine that with a short turnaround, we're just trying to make sure that vaccines getting into the right arms. So for example, with one of our retail pharmacies, we provided a list from our list. So this is the list that has been generated over the last 2 months. We provided them with names of folks. Well, let me take a step back. The state call center is going to be helping in a large part, this is to try to get people who do not have access to the internet. We're using the state call line to try to enroll people in some of the clinics, in the pharmacy clinics. Some of the pharmacies have their own eligibility tools where they can identify people who meet all the prioritization strategies. Until we have the ultimate goal is for every vaccinator program, so whether it's a retail pharmacy or a health department or a primary care provider, to use information gathered from that list. But we still, as I mentioned, it is a work in progress. We still have work to do. So in the meantime, we are doing the best that we can to get people from the list into the hands of our partners so that they can pull people from the list into their clinics. Does that help?
Yeah, I know that's one thing that people are going to say, hey, is Walgreens going to reach out to me, or do I need to let Walgreens know? But you're saying they have ways of getting the names and will be calling people, correct?
Yes, either calling or emailing. And that's what we're still working out.
Okay, yeah, because so many people, as you know, it's across the communities don't have access to the computers, especially the older folks. So
Right.
That's great. And I do want to put a plug out there too about the new call center hotline. It has been very, very helpful for, I know, people who are calling me to have a place to turn. So the other thing I wanted to ask you about is the sharing of links, and you touched on that briefly. And Dr. Vola has said that PrepMod is supposed to fix those problems by the end of the month, but who knows whether they will or they won't. So could you walk us through the problems what happens when people just text these, Facebook them, email them to everybody and his or her brother who thinks that just because the system lets them on, that it's a-okay to do this.
Yeah, I'm so thankful that you brought this up, because you can imagine how upsetting it is for us to find that after all of the time and energy we've put into making sure that the right people, when it's your turn in line, you get notified by us. Like, that is what we've been promising to the community. And to find that there are people who are willfully choosing to use the system in a way that it is not intended to be used, it's hurtful to our community. And I think that that's one of the messages that's really important for people to understand. This is not a situation where the vaccine is coming out of the air. If you take the link and send it to someone who is not at high risk for having COVID-related hospitalizations or death, you are taking that vaccine from someone who is at higher risk. And I use the term unethical, and I don't use that lightly. It is not right for someone to take the link and share it with other people. These links are intended for a target population who's older than 65. Now, one thing that we have done at the health department, we're not using PrepMod yet, except in the very small community outreach vaccination teams where we're registering people and getting them vaccinated right then. But with our partnership clinics with Carilion, it has been problematic because they're using PrepMod. The most efficient way for us to get people registered for that vaccine is to send the link out to people on our list. Now, what is happening is most people are doing the right thing. Don't get me wrong, most people are doing the right thing. But when one person shares it with her neighbors or on Facebook, she's inviting people to take the spots of our older than 65 population. And that's just wrong. There's no other way for me to say it. That is wrong, and it should not be done. Now, what we've done is we've put even stronger language on our email saying this is not to be shared. And if you share it, you're jeopardizing your own spot with the vaccine. I've also told Carilion, this is a partnership. So I've told Carilion that they have my permission as the health director to cancel any appointments for people who are under the age of 65 if it's our over 65-year-old clinic. And that is in the email, that you may have your appointment canceled either by email or if you show up, if you do not meet the eligibility criteria. So you can imagine, and I'm sure you can hear it in my voice, it's just really hard when we get an email from someone saying, I'm 80 years old and I just found out that my 40-year-old neighbor got the link. It's heartbreaking and it's wrong, and we need people to do the right thing. If you get a link, that is for your use only. Do not share it. Do not post it. It is for your use only. So I hope that people hear that message loud and clear. Misuse of a PrepMod link, it is a flaw in the system. The system needs to be fixed. But in the meantime, people need to do the right thing.
Thank
Hi,
you.
Dr. Morrow.
Dr.
It's
Morrow
Leanna.
has full. Hi, Leanna. She has a full afternoon, so we'll do one more question. Leanna, since you already had a chance to chime in, is there anyone who hasn't yet had a chance to chime in with a question today that would like to ask one? Okay, Leanna, your lucky day. You're going to be the last question today. Go ahead, please.
Thanks. Again, another question that we have received from viewers that I just want to try and get out in front and answer that question for them. At the time that the vaccinate.virginia.gov website was released last week, we understand that data from local health districts about who had already pre-registered in the weeks leading up to the rollout of the new website was still in the process of being merged. As far as you know, has all local data fully been merged into that system? So if somebody pre-registered a couple weeks ago, should they be in that registration system?
It is an ongoing process. I'm not sure is is the bottom line. It is my understanding that the merge process is still underway. But what I can say at the local level, I know that people are concerned about where they are in line, that at the local level, we are still using the database that we pre-populated the state database with. Knowing that the merge issue has not been entirely resolved, we're still using our database, but we're also paying attention to the state database as we see it. So we're constantly monitoring our database and the state database. And, I see Christy nodding. We have a team of folks that are looking at this. And our goal is, once the merge function is working properly, once we have confidence in pulling the names directly off that state registry, we are definitely going to be doing that. In the meantime, we're doing a combination, if that makes sense. But we're trying to make sure that we have not lost track of anyone by still looking at our own local databases. I hope that that's helpful.
Yes, that makes sense. And thank you very much for taking my question.
Of course.
Well, thank you all very much for joining us today. This was probably the first of ongoing health equity conversations. As developments continue to warrant, be more than happy to host another event like this. In the meantime, thank you all very much for your interest and participation. Dr. Morrow, thank you for your time. And again, if you have additional questions, you're welcome to email me or hold them for the Friday briefing that we would expect to hold this week. Thank you all. Take care.